Hi, I'm Professor Dr. Erkan Yıldırım. I'm a lung transplant and thoracic surgeon. In this video, I would like to talk about application and post-treatment process of COPD balloon treatment. So first, how we prepare the patients for this procedure. I'd like to get into detail. Patients are consulted with anesthesia to determine if general anesthesia is needed and if there is any risky situation, and this could be detected as well. And we get medicated with Ventolin breathing test is performed to determine the patient's final stage of COPD. And the procedure can be performed on patients in stage 3 severe and stage 4 very severe, or in advanced stage 2 if they have significant complaints and desire for the treatment. Patients are checked for blood thinners, which must be stopped at least 5 days prior to the procedure. Cardiological and other anesthetic consultations are completed, and patient consent forms are filled out and signed. Patients are informed about potential side effects and outcomes of the procedure. On the procedure day, a date is set and assisting personnel are notified. Patients arrive on an empty stomach, at least 8 hours of fasting. This is very important. And when the patient is hospitalized, we get chest x-rays and blood gas analysis, and these results are checked before the procedure. Patients are advised to continue taking their regular medications for such blood pressure, sugar, lipids, and cholesterol, but to stop blood thinners at least 5 days prior to the procedure. The procedure, we can call it bronchial resection or bronchial wall scraping. The patient is intubated with single lumen tube and gets in under general anesthesia. A bronchoscope, flexible bronchoscope, is used to clean the airways, aspirating thick phlegm, and bronchial lavage is sent for culture, microbiological culture, to determine appropriate antibiotics if any infection exists. The scraping procedure takes approximately 1.5 to 2 hours time. The surgeon enters the 10 segments of the right bronchus, then the 9 segments of the left bronchus, carefully scraping each one until it forms and hardened phlegm is removed. A thinner bronchoscope is then, as a second stage, used to reach the very ends of the bronchi, where the alveoli, air sacs, are located, to ensure the air passages are completely open. After procedure, we get blood gas values are rechecked before the patient wakes up. If carbon dioxide levels are high, the patient is monitored in the intensive care unit with CPAP, continuous positive airway pressure, if needed. Once blood gas levels are stable, the carbon dioxide is less than 50, and the patient is conscious, they're moved to their ward, their room for routine treatment. Patients are discharged after 2 nights of observation with instructions to return for a checkup in 10 days. Please do not hesitate to contact us upon your complaints. Just get into contact and we would like to help you and fix your problem. See you. Bye-bye.